So I have a morning gratitude practice I didn't get to do this morning, so I hope we'll all do it together. I just want us to pause and realize how grateful we are to be here in this moment. People came from far and wide, and you came to learn, to be inspired, and to connect. And you get to spend 20 minutes with two of my favorite humans on earth. So I'm grateful for that, and I'm grateful for you in advance. And thank you all for coming. Yes, we can clap. I'm also grateful for applause. So I'm grateful for this session in particular, talking about mental health. I have three amazing uncles in my life who I learned from and am inspired by, and all three have attempted suicide at different times in their lives. They're all here with us in this planet today, but it's because of people like Zach and Elyse who inspire me to make sure that all of our relatives, all of our loved ones, everyone we meet has a champion. And mental health affects so many of us, if not personally, in our families. So thank you again for what you do. But they want to know what you do. So Elyse, we'll start with you. Who are you? What do you do? And what drew you to this work?
Well, first of all, thank you. Thank you, Rachel, Zach, the whole
So
SIS
DC was
team.
different,
this
too.
This is like a reunion for so many of us and really special. For me, like many of us, I came to this work through personal family struggle and story, and in many ways, I think when I talk about my role in all of this, it's really about turning pain into purpose and passion. And I spend my time leading Selena Gomez's Rare Impact Fund, which is her foundation focused on youth mental health, as well as leading social impact for her brand Rare Beauty, which focuses on addressing mental health and self-acceptance through every part of our brand. And in many ways, she gifted me and the world her platform and her brand's platform to really make a difference and influence around mental health.
Amazing. Zach, what drew you to this work, and what is it that you're doing?
Sure, yeah. Well, I never thought I'd go into the mental health space. You know, I have a background in consumer technology with a focus on entertainment and gaming. And after my father died by suicide, I was having a really tough time. Was diagnosed with complex PTSD, generalized anxiety disorder, and depression. Was doing unhealthy things like self-medicating using alcohol. And I realized something had to change. And so the first thing I discovered was that service was very healing for me. And ultimately, I found myself working with several mental health organizations and was healing from the trauma through committing to supporting other organizations. The thing I started to realize, though, is that I wasn't taking care of myself in the way that I needed to. And as a direct result, I was burning out, getting exhausted. And I realized that lifestyle interventions were, actually a thing, meaning, yeah, we need to focus on prevention for mental health, right? But lifestyle interventions, specifically to define them, are nutrition, fitness, mindfulness, meditation, therapy, community support, specialist interventions like breath work, intermittent fasting, all sorts of other ways, spiritual practice, and so forth. And when I discovered that foundational approach, I realized there's an opportunity to create a brand that advocated for lifestyle of interventions to support mental health. And that's why I created PIM, which is a company that creates nutrition for mental well-being and tries to deliver education in a meaningful way. That has since led to some other initiatives, which I'm very excited to announce, one of which is launching the California Institute for Stress and Resilience.
Ooh. We all need that.
Yeah, so working with a collection of doctors and psychiatrists, we want to be able to put resilience research and stress research front and center, because the 21st century paradigm is really around building foundation for self so we can manage all the stress the world has to offer.
I love that. There's no better audience for you than this one, because these are people out in the world trying to create innovation, but if we don't heal ourselves, we can't change the world. So it's heal yourself to heal the world. And do you want to give a shameless plug? Where can we find PIM online?
Yeah, you can find PIM at pim.com.
Amazing!
PYM.com. And the awesome thing is we're launching all these new products primarily to support foundational neurotransmitter health, but also to help people understand the other things they can do. It's not just about selling products, it's about delivering education. while we support initiatives like Bring Change to Mind, since launching, we've raised over $100,000 for mental health nonprofits. So it's been incredible.
That's incredible. Thank you, Zach. And Elyse, I'd love to ask you, what are the challenges you're seeing right now in the field? Mental health has become almost a pop psychology conversation. We had May, which is Mental Health Awareness Month. Now we're in June, and we can't forget that. So what are the challenges you're seeing, and how might that have shifted during the pandemic?
Yeah, well, I'm going to start with the positive here. So I think, mental health has always been incredibly prevalent. If we looked around the room and we asked folks to stand up if they either themselves had been impacted or were a caregiver or had a close friend or family member who either is no longer with us physically or there's a sense of loss of who they once were, every single person in this room would stand up, whether you actually are aware or not. That's how prevalent this issue is. And what COVID did for us is it just spotlighted it. It brought it to the forefront. It brought it to headlines so that we could have more Selenas out there. We could have more Zachs out there championing this work and coming together in collaborative ways. And I've worked on a whole slew of different issues. I've never, ever, ever seen an issue so collaborative because so many people come with personal passion and we just don't have the luxury of time to be inefficient about funding and about partnership. So that's what's been really positive. The challenges are, mental health has been historically one of the most underfunded issues globally. Only 0.2% of annual budgets go to support mental health. It's part of why we're doing the work that we're doing. Right now, Selena's Rare Impact Fund will be the largest known entity focused on youth mental health in the United States and likely globally at the moment. And so to date for us, we've raised over $6 million. We've deployed a lot of that money. The brand donates 1%, but we also fundraise. And so I think the biggest challenge here is really around funding and systems. The systems are still deeply broken. They don't support preventative care. The hospitals are overworked. So we need to work systemically, but we also need to work financially because it is so incredibly underfunded, and that's the only way that we'll be able to increase accessibility.
Amazing. And I'd love to hear what you see as the challenges, Zach.
Sure. Well, the primary form of advocacy that I practice is systems-based change. And really what we're seeing is a national mental health care system that's under-equipped to manage the extensive issues relating to crisis care. And the challenge is there's just not the piping, educational and otherwise, to bring enough practitioners into the marketplace, into the world to provide crisis care solutions. It's very expensive. It can be great strain on healthcare systems and hospital systems. And so what I'm really keen on focusing on is preventative-oriented solutions, whether that involves peer-to-peer support, community support, but again, things like nutrition, fitness, mindfulness, meditation, so forth, because they're helpful not only in alleviating the burden on the crisis care system, but also they create tighter bonds, help people feel better connected, and we need to take a research-backed approach to really bringing the data front and center. Because with that data, we can in turn create more advanced risk models and understand that we're actually saving money for the systems that are overburdened through establishing preventative solutions. They're actually very cost-effective and can provide ways to support individuals and communities very decisively without creating additional burdens across the board.
And they're preferable. If I would ask everyone in the audience to raise your hand if you prefer to have a stressful moment where you are needing crisis care or to have preventative measures where you're doing meditation and breath work, everyone would prefer preventative care. Well, sign us all up at lunch. So I definitely think that that's a key part of the puzzle. So there's amazing companies doing really innovative work and amazing partnerships. So bravo to all of you. Now let's dig into the ones who aren't yet there. What advice do both of you have for companies, brands, celebrities, influencers who haven't yet gotten into this conversation? Where can they start, and how can we help bring them along? Because we need everyone on team mental health and wellness.
I love this question because, again, I think it comes back to there's no one that's not impacted. So if you're a workplace, there is no issue that matters more to your company than this issue, because it's impacting productivity, it's impacting your financial bottom line, it's impacting absenteeism. So internally as a company, this is your #1 issue, and it intersects with everything. It intersects with racial inequality. It intersects across the board. So it's absolutely an issue that touches everywhere. If you're a company on the inside, I would advocate around culture change. And everyone has a story. Start from the top, educate. You have to bring in educators to share and inform. At our company, we train every employee in mental health first aid at work. It's an incredible program that just helps employees understand how to recognize, they're not first responders, they just recognize signs and symptoms and know how to interact with an employee if someone comes to you and they say that they're struggling or they need to seek care. Of course, there's issues around benefits. Those are sort of the obvious ones, but the harder ones are that culture change. And that's really around starting the conversation. And externally as a company, invest. When you're thinking about your social impact programs, again, invest in mental health. It crosses education. We need to bring more mental health into school systems. It impacts communities. And there's so much incredible work at your fingertips and so many people that want to partner, and they need your support.
I love that. Zach, how do we get more people into this game?
Well, first off, I'd say, for the individuals out there who want to establish change in a system or catalyze culture change, first focus on yourself. Establish what I call mental hygiene rituals that work for you, because you need that foundational approach. Secondly, start thinking about a strategy, right? Understand the systems at play, whether it's in the workplace or in the policy environment, and then break it down to programming, awareness, research, advocacy, policy. What can be done? What are the resources available that can be deployed, whether they're people, investment, distribution. There's all sorts of ways to do that, and really take a systems-based approach. It doesn't happen overnight, and behavior change can be very challenging. So the key thing is, on top of that, really looking at our personal biases. Together, they form stigma. Often, those biases were created as coping mechanisms. And so, forgive yourself for those biases and say, hey, there's an opportunity to really reevaluate how I'm actually coping using the stigma, and then take the opportunity to break it down.
I love that.
Can I add something to that?
Yes.
So Zach mentioned biases, and I think one of the biggest learnings in the company where I'm working is that a lot of these biases were set by older generations, especially when it comes to this issue. We work in a very young company. Our employees are very young. Mental health is one of the top issues that they talk about. They talk about it openly. Our community, our customers come to us for the work we do in mental health. And so we need to make sure that we're actually breaking down those biases and that stigma somewhere in the middle so that we don't shift the younger generations, because older generations have established that stigma and that bias, but it's not actually all around us if we listen. So that's the first thing I wanted to mention. And the second was just, don't let perfection be the enemy of success here. I think a lot of times companies worry that they have to do everything and they have to do it perfectly. And we're all on a journey, and we're all going to make mistakes. What's most important is that you start somewhere and you partner with organizations that can help you strengthen your company, both on the inside and on the outside.
I love that. So in the spirit of strengthening companies, we all want to know how we can help you and you. So Zach, let's start with you. With everything you've got going with PIM and these other initiatives, how can we all raise our hands and help supercharge your work?
Yeah, strategic partners, whether it's investment, partnerships like ones that focus on amplification or awareness, and then distribution partnerships, potentially retailers who want to understand what it means to have mental well-being merchandised in their retail outlets. We want to be educators. We pride ourselves as educators. So anywhere where nutrition for mental well-being could be a thing, it likely should be a thing. And so we're looking for strategic partners.
Amazing. I feel like I see some strategic partners out there. Elyse, how do we help you, Rare Beauty and Selena Gomez?
Okay, well, I have 2 shameless plugs. The first is, obviously, shop with Rare Beauty. 1% of all of our sales support the Rare Impact Fund, but we also educate around mental health. The same way we launch a new product on social media, we work with expert partners to disseminate mental health content to young people every single week, and it's some of our most saved content on social, which is incredible. And the second is, and this is my shameless plug, Selena is hosting our first inaugural Rare Impact Fund benefit this fall in October in Los Angeles. We are raising money for this fantastic event. I have team members here. We would love to talk to you and partner with folks who want to get involved in the benefit. It's taking place on October 4th, and we want to work with you.
Amazing. So Elyse, you gave us a call to action. I don't know if you noticed it, but you said if everyone here were asked to stand. And so I think we should actually take you at your word. So if there's anyone here who has someone close to them who they love, who has been affected by mental health, I'd ask you to stand. And if there's anyone here who has a company in which they reach employees, customers, where they have followers, or where they inspire a younger generation, I'd ask you to stand. And now that you're standing, I want you to close your eyes and ask yourself, what do you stand for? Because this is a moment I want you to remember, where we were all together standing up for mental health. And now you can make a change. You can choose to use your voice, your company, your dollars, and your influence to make sure that 20 years from now, there doesn't need to be a conversation about why it's important to invest in mental health. Thank you for being with us, for being partners, and for joining us today.